Four Virginians die every day due to an opioid overdose. While the figure reported by the state health department is staggering, we know, of course, the victims are more than just a number. Representative Abigail Spanberger is making her push to curb substance abuse in recognition of a young woman who lost her life. Congresswoman Spanberger, thank you so much for joining us this morning. Good to see you.
Thank you so much for having me.
The numbers are just staggering. In 2020, Virginia reported a record number of drug overdose, including a 47% increase in the number of those deaths from 2019 to 2020. 2021 is expected to be even higher. So let's talk about this legislation you're introducing. What is it about, and how is it different from other initiatives that we've seen?
This piece of legislation recognizes that every person who's facing addiction, who's struggling with their substance use disorder, and the families that are reeling after an overdose death of a loved one want to see changes. And we know that since 2013, overdose has been the leading cause of unnatural death within the Commonwealth of Virginia, more than car accidents, more than shootings, more than other means of unnatural death. But we have the means to take action. So this bill does a variety of things. It looks at the 12 different grant programs that are already in existence that take a comprehensive look at funding prevention and treatment and recovery. It reauthorizes those programs into the future. And it does things like encourage alternatives to opioid use in emergency departments. When I have visited with jails that have recovery programs within the jails, I've heard stories of women who, after giving birth, were given opioids for pain, and that led to a decade-long addiction. I've heard from and spoken with individuals after a shoulder surgery, athletic folks after a shoulder surgery that led to an addiction, young people after they get their wisdom teeth pulled out, they are prescribed opioids, become addicted, and years later that path ends so frequently tragically with overdose. The bill also expands jail diversion programs so that those who are really struggling with mental illness or those who are really struggling with substance use disorder get the treatment they need and stop that in and out of the jail cycle. It also improves access and understanding of medically based treatments. So if someone's experiencing an overdose in the throes of it, how to use naloxone and other overdose reversal treatments. And it recognizes the real mental health element of our substance use disorder, frankly, just challenge that we're facing as a nation, a crisis.